welcome to the show this morning. The topic this morning is Nashville Hospital and the Mother-to-Mother Fund at Meharry. And of course we have to talk about the Nashville Hospital Association and situations. Miss Judith McCoy. And of course, with Miss McCoy is Miss JBusbee. And of course, ladies, let me welcome you to the show this morning.
Thank you.
And to have you, Miss McCoy, straighten out the name and the title of this show for us tonight. And of course, Miss Busbee will, both of you will give us some information in reference to some of the things that we're going to talk about. And after which we will have a second segment, and then we'll get into a deeper discussion. But in the meantime, let's have the two of you talk about your background, your education, and some of the things that were influential in terms of bringing you to this particular set this morning, after which we'll get into some of the other things dealing with your foundation, Mother to Mother, Ms. Busbee.
Okay. Well, I'm Judith McCoy, you got that right, and it's Nashville General Hospital at Meharry, and we'll talk a little bit about that, but it's Nashville General Hospital now on the campus of Meharry. I'm a native of Los Angeles. All of my education was in California. I've been married 41 years, and my husband, who is a minister but is in church administration, was transferred to Nashville. I have 3 adult daughters, I have 3 grandchildren, and I've been in healthcare more than 25 years, with most of those years with the Hospital Corporation of America system. I've been at Nashville General just a little bit more than 2 years now, and I was passionate about working in an area where I would be serving the community, giving back to the community at this stage in my life, and I have that opportunity to do so. So that's why I'm there. And then I wanted to talk about the most generous donor that we have at Nashville General Hospital, and that's Mrs. JBusbee. So after she's introduced herself, and we'll get into a little bit of the program, then you'll know what we're talking about and the service that she's providing to our hospital.
Very good. Let's continue that introduction there, Ms. Busbee.
I'm JBusbee, and I'm from Charlotte, North Carolina. I moved to Nashville 3 years ago with my husband from Boston, where he was doing a retina fellowship. He joined a group, a retina-only group in Nashville, and when we left Boston, I was on the board of the Women's Union, which is a they actually control most everything in the city. It's the oldest women's union in the country. And I was very involved with the mentoring programs and the women's shelters. And when we found out we were moving to Nashville, I started Mother to Mother. And quickly, after moving to Nashville, met Judith McCoy and started some of our programs with the hospitals.
Very good. And of course, Ms. McCoy, let's talk about Nashville General, that situation, and of course that will give us for the next 3 minutes. And when we come back after this first commercial break, we'll allow Ms. Busbee to start us off dealing with the Mother-to-Mother program for the first few minutes of that particular segment.
Being responsible for public relations and marketing, you look at the areas of need in a facility, and I would say the 99% of the mothers in our hospital could use a little assistance. And most hospitals give you a baby bag, or they give you a lawn sign, or they give you something. But I had this dream, and I wanted to give every mother that delivered at Nashville General Hospital a baby shower. And I wanted people from all around to come in and donate things to our baby shower, so that every mother would go back or would leave the hospital with enough goodies that they could take care of their baby comfortably. Well, soon after I had that dream, Nancy Mettinger from the American Red Cross introduced me to JBusbee and told me that I needed to meet her, and said, talk to Janie about your dream and your vision for the hospital and the mothers that deliver there. And when I shared with Janie my dream, she said, oh, I'll do it all. I'll create the baby shower. You don't have to go anywhere else, and we'll do it. I was like, you're kidding me. And I explained to her what I wanted. She said, I'll do it all. We'll do it all. And so Janie taking it from there.
Go on. Explain how you got involved in this.
Well, after meeting Judith, we decided what we wanted to do was have every baby that was delivered have the mother have a bag of basically gifts to take home in case she hadn't had a baby shower. So we, toyed with the different ideas of what needed to be in it and came up with the final version, took it to compliance. And so now every baby that's born at Nashville General gets a bag that has diapers and wipes and outfits and hats and blankets and pacifiers.
Now, this also has something to do with Nashville General's attitude toward children. I mean, we want to speak to that because I think that we're just about ready for our first commercial break. But I think that the idea of mothers to mothers as a foundation, this is a great idea, but I think that it goes way beyond that because I think it says something about Nashville General's attitude toward babies and toward children, and I think that that's a very, very positive thing, and I think that since you're involved with Mother to Mother Foundation, etc., we'll allow you to sort of explain that. And of course, we'll be back following this very, very short commercial break. Before we had our first